Sharon. The overlooked health risk after 60, hearing loss. Have you noticed that you are turning the television up a little louder than you used to? Maybe you sometimes have trouble following a conversation in a crowded restaurant. Or perhaps you find yourself asking people to repeat themselves more often. These changes may seem like a normal part of getting older, but hearing loss deserves more attention than many of us give it. Hello, I'm Dr. Rose, and today we're talking about an often overlooked part of healthy aging. Hearing loss after 60. Hearing affects much more than our ability to hear sounds. It can affect communication, relationships, independence, safety, and our connection with the people around us. Hearing loss can happen gradually. Age-related hearing loss usually develops slowly. That is one reason it can be so easy to overlook. You may not notice the change yourself at first. Instead, you may begin noticing small things. You may have difficulty understanding people when there is background noise. You may hear someone speaking, but have trouble understanding exactly what they said. You may turn up the television or telephone. Or family members may tell you that you are not hearing them as well as you used to. According to the National Institute on Deafness and Other Communication Disorders, about 1 in 3 adults between ages 65 and 74 has hearing loss. And nearly half of adults over age 75 have difficulty hearing. So this is not an unusual problem. But common does not mean it should be ignored. Then, hearing loss can affect communication. Think about how much of our daily lives depends upon conversation. We talk with family members. We speak with friends. We communicate with doctors, pharmacists, neighbors, store employees, and people in our communities. When hearing becomes difficult, conversations can become tiring. You may have to concentrate harder to understand what someone is saying. You might misunderstand part of a conversation or miss important information. Over time, some people simply begin participating less. They may stop going to restaurants because it is difficult to hear. They may avoid meetings, church gatherings, family celebrations, or other social events. And that brings us to another important concern. Hearing loss and social isolation. When conversations become frustrating, some people begin withdrawing without even realizing it. Instead of asking someone to repeat themselves several times, it may seem easier to sit quietly. Instead of joining a group conversation, you may decide not to participate. But staying socially connected is an important part of healthy aging. Research has found that untreated hearing problems are associated with social isolation and loneliness in older adults. So if you find yourself avoiding people because conversations have become difficult, don't simply assume that you have become less social. Your hearing could be playing a role. What about hearing and brain health? This is an area receiving a great deal of research attention. Studies have found an association between hearing loss and cognitive decline in older adults. That does not mean that hearing loss automatically causes dementia. Researchers are still studying exactly how the two are connected. One possibility is that when hearing becomes difficult, the brain has to work harder to interpret speech. Another possible factor is that people with hearing loss may become less socially engaged. A major study funded by the National Institutes of Health also found that, among older adults who were already at higher risk for cognitive decline, treating hearing loss with hearing aids slowed cognitive decline during the study. More research is needed, but it gives us another reason not to dismiss hearing changes as unimportant. Hearing, balance, and safety. Hearing also plays a role in how we interact safely with our environment. Being able to hear approaching cars, alarms, doorbells, telephones, and warnings can be important for independence. Hearing loss has also been associated with a greater risk of falls in older adults. Hearing loss itself does not necessarily mean that you have a balance disorder. However, if you are having difficulty hearing and experiencing dizziness, unsteadiness, or frequent falls, those symptoms deserve medical attention. What can you do? First, pay attention to changes. If people frequently sound as though they are mumbling, if you have trouble hearing in groups, or if your family keeps telling you that the television is too loud, consider having your hearing evaluated. Second, protect the hearing you still have. Avoid prolonged exposure to extremely loud sounds, and use appropriate hearing protection when you know you will be around loud equipment or music. Third, don't be embarrassed about hearing assistance. Depending on the type and severity of hearing loss, options may include hearing aids, assistive listening devices, communication strategies, or other treatments recommended by a hearing professional. And remember that sometimes hearing difficulty can have causes other than normal aging, including earwax buildup, certain medications, infections, or other medical conditions. That is another reason an evaluation can be helpful. The takeaway: healthy aging isn't only about blood pressure, weight, exercise, and nutrition. It is also about maintaining our ability to communicate, stay connected, remain independent, and participate in life. If you've noticed changes in your hearing, don't simply dismiss them because you're getting older. Talk with your healthcare provider or a qualified hearing professional and find out whether a hearing evaluation is appropriate for you. Sometimes improving the way you hear can also improve the way you connect with the world around you. I'm Dr. Rose. If you found this information helpful, please subscribe for more health-related topics and share this video with someone who may benefit from it. And remember, healthy aging is not simply about adding years to your life. It is about protecting your ability to enjoy those years.